Well, it is something that every parent dreads, taking a child to the hospital. And the main question that often comes with that is it going to hurt? But pediatric sedation can really help ease pain and ease anxiety. Joining us now to talk much more about this is Dr. Redman from East Tennessee Children's Hospital. Thank you so much for coming in.
Absolutely.
Let's talk about the difference, because there is a difference between sedation and between anesthesia. What is the difference?
Well, we like to think of it on kind of a continuum, where on one end you've got someone who's awake and alert and doesn't need anything. On the other end, you've got things that are very painful procedures, like operating room procedures that need general anesthesia. Sedation lies in that broad area kind of in between there, and really it has to be tailored to what's being done and what the child needs.
Explain what the procedure is at Children's Hospital in terms of how you gauge what a child really needs and exactly what they can expect to go through, because does it involve needles? Does it involve laughing gas? What will they experience there?
And that's one of the great things about having kind of a full-service pediatric institution, is there's a wide range of possibilities of things you can use. So you can really tailor it individually. Now, for a lot of things, we know, of course, commonly that a 2-year-old who needs a 45-minute MRI is not going to be expected to sit there with just minimum for the whole thing. So there are certain rules that we, tend to follow, but individualization is always the key.
Yeah, what can parents expect in terms of coming out of sedation? Because I do know that really varies child by child as well, but what can parents anticipate? Give us the scope there.
Yeah, absolutely. It depends a lot on the agents that we use. Now, a lot of times for these kind of ones in the middle, like a diagnostic imaging or MRI or a CT, we can use single agents, things that don't give you a lot of hangover effect or nausea, or things that you sometimes see when you're having a bigger surgery. And especially the newer agents that are a lot faster acting, they also tend to wear off very fast, so those effects are mitigated.
And that's so important for parents to know, because I think everyone, if you haven't been to the hospital in a long time, you automatically associate sedation with, oh, my child's going to wake up and be nauseous or throwing up, or even that it might require an overnight stay, but that's not always the case. Some of these can be day procedures, correct?
Absolutely. The vast majority of what we're able to do is be able to do just a one-stop visit and a relatively quick recovery.
I have to ask you from personal experience, I've been in what is traditionally called at the hospital the wake-up room when kids come out of sedation. Even that, much like the hospital, is designed to kind of be a fun place, a not scary place. Explain what's inside, what the kids get to see when they begin to wake up or come out of sedation.
Absolutely. The most important thing that we're able to do is have kind of parental, to have with our sedation service, have the parents available when they go to sleep and have the parents be there before they wake up. So in addition to all of the child life things and fun toys and games and all the things that we try and surround them with, most important is a comforting presence.
And if your child does have to come to the ER, to the hospital, best advice to parents sitting at home to ease their anxiety on the drive there?
Most important is to talk about it and kind of in terms that they'll understand, explain kind of what's going to happen when you get to the hospital, so it's less scary than just pulling in and having it all be a new experience.
And we need to remind parents you're going to see friendly faces like this when you get there, so it can't be that bad. Dr. Redman, thank you so much for coming in.
Thank you.
We appreciate it. And we want to remind everyone, if you have a question about your child's health, all you have to do is email Lori Tucker at ltucker@wate.com, and be sure to join us every Thursday right here on 6 News at 5:30 to see if we use your question on the air.